Hello everyone. In this video, we will get to know about very rare but now getting very common among COVID patient, that is mucormycosis. We will see the various aspects uh, of this particular disease through scientific literature and try to find out about what this problem actually is and which particular microbe is doing it. What are the site of infection and who are all at the risk, and what are some of the prevention and cures available for this particular disease, and what an expert or people who are working in this particular area has to say about it. So please watch this video till end. So as you know that nowadays it's very common that you are hearing about this CAM, that is COVID-19 associated mucormycosis. So we'll see what it is and how it is associated with COVID-19 and who are the people who are getting infected from this particular disease. So first of all, we'll get to know what actually this mucormycosis is. So to know that, there is a paper I have downloaded and studied thoroughly. So I will tell you some of the aspect of what it is through this paper. So as you can see, this is a fungal infection, right? This is a fungal infection. So fungus is a kind of microbe, and that commonly you can see in everywhere, like in kitchen, moist, mainly the moisture places in soil. You can see the greenish infection in bread, right? So that is a fungal infection that is everywhere. So this mainly this particular micromycosis is mainly due to this mucoral fungi. Okay, so that's also been caused by this zygomycosis. That's why it's also sometimes termed as mucormycosis as well as zygomycosis, and sometimes they also called as phycomycosis, right? So these are the some common terms for this mucormycosis disease, and this is mainly caused by this particular fungi called mucorales, which are called as mucorales, right? In this particular fungi, the most common genus which are actually responsible for this is mucor, right? Mucor or rhizopus. So what happens is there are various spores of this particular fungi which is dormant in condition, which is like stable in the normal condition, right? When a patient inhale these, so they start getting infected, and mainly the site of infection is start through the lungs, right? So mainly this is a fungal infection done by this mucorales and the genus Rhizopus and Mucor, right? So this is the question of what it is. So what it is a fungal infection and done by the mucorales, right? So the second thing is what is the site of infection actually? So mucorales species are, you can see these are vasotropic and causing tissue infection. So inside tissue actually they cause this infection, and mainly from cutaneous means your hair, your skin, your nails, right? Rhinocerebral, it's including your oral cavity, your this nasal cavity as well as your brain. So then they start with this nasal cavity, means your nose cavity, and goes through upper side to your brain, and and also this sinopulmonary, same, the basal nasal cavity, and also including your respiratory tract, means your lungs. So you can see how dangerous it is. It can cause infection in your skin, in your nose side to the brain, and also to the lower respiratory tract, that is lungs. So that's why it is very fatal, and mainly the people who are immunocompromised are the host of this particular fungi. So it's very commonly you can find anywhere, but normally our immune system are so capable to fight against it. But the people who are the patient of this COVID-19 are already immunocompromised. Their immune system are not working well, and they are on the treatment with various medicines. So this all condition make them susceptible to this particular fungi, right? So the next question is actually who are the patients which are getting critical ill by this particular disease. So for this I have read another paper that is about this coronavirus disease associated mucormycosis. It's a case study and a systematic review of the various other literatures what this author has found. So what they have to say is mainly the COVID patients who are in the final stage, like after 8 or 10 days, if they're not getting well, they're treated with the various steroids. They're called like glucocorticoids, right? These are the steroidal compounds, steroidal drugs which are given to them to actually minimize their immune system. So what happens is, in a severe this COVID patients, the cytokine storm actually happens. Cytokine storm means, the because your infection is not getting well, so your body actually start doing this hyperimmune. So hyperimmune actually started in your body, means more and more immune cells actually get activated to fight against your disease. But actually it happens in opposite for your body, so your body get starting ill because that particular disease is not getting well. But the inflammation occur due to this high immune system response, right? So to minimize that immune system response, various steroidal drugs are given to the patients, right, in the last stage, from 10 to 15 and 17 days. So because of that, your immune system is not getting compromised, right? Your immune system now get weakened due to this steroid, right? At particular point, because at that time the patient is immunosuppressed, these particular mucorales, they infect, and they do this disease called mucormycosis. So what they have found is, uh, out of so they have done a review where they have found that out of the 8 cases included review, diabetes mellitus was the most common risk factor. So the patient who are already diseased with the diabetes is on the higher risk for this particular disease. And so what they have done in their case, what they have done is they given this amphotericin B, it's an antifungal drug, to the patient, and that patient got discharged. So they have also reported their one report study from the hospital, that patient got well by this particular treatment, amphotericin B. While they have reviewed other papers where other authors have reported the similar thing, they have found that diabetes is the main common cause, and who are at the higher risk, the concurrent glucocorticoid therapy probably heightens the risk of the mucormycosis. So the patient with the diabetes and also getting these steroidal drugs are the at a higher risk, right? So they are the at the higher risk, and they are actually getting developing this particular disease. And mainly when the patients are discharged from the hospital, so after getting discharged from the hospital, when they go home after 10 to 14 days, they actually catching this particular disease. So that's because their immune are actually suppressed, they are already a patient of diabetes. So this mucormycosis is actually getting happened. So recently, this Dr. Guleria has said that uh, if we have to actually inhibit the misuse of steroid, then only we can suppress this particular disease. So what doctors are doing majorly, because of this stress and tension, only because of the severity in the patient, they are giving the higher dose of steroid, or maybe the more common dose. I don't know about more about medicine, but Guleria has said that if you do if you not misuse the steroid, if you not give extra doses without any need, so we can actually uh, calm down this particular disease. And also he have said that mainly because this infection arises due to soil, air, and even food. So the patients which are getting discharged from the hospital, they should avoid going into like dust, or doing farming and all other things. They should they should well maintain and should follow the hygiene throughout after getting discharged from the hospital. And also the hospital management should take the uh, take the samples from the air, and should test that what are the range of this fungus spores in the air, in that ICU and all the hospital premises, right? So in that way they can actually cure as well as also the prevent this particular disease.